Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In our previous session, as we have started discussing about nutrition, about the various factors that can influence the nutritional intake of a person, about how we can assess the nutritional status, that is by the use of 4 methods, which is the anthropometric, the biochemical, the clinical, as well as the dietary method. So here, after you have assessed the nutritional status of a person, if you find that the nutritional intake is low, then you can advise them to have a well-balanced diet in order to gain the nutrition which he or she requires. So here, if you encounter these type of patients who is not able to have their food because of the disease condition which they are suffering from, then you can provide the tube feeding. In this manner, it will help one to acquire the required amount of food and nutrition which he or she needs to consume. So here in today's session, we are going to discuss in detail about the nasogastric intubation. This nasogastric intubation is a procedure in which a thin plastic tube will be used and will be inserted into the nostril towards the esophagus and then down into the stomach. So once this tube is properly placed and secured, the healthcare provider, such as a nurse, can start delivering the food and medication directly into the stomach or even obtain substances from it. So as I've said that if a person is not able to have food because of his disease condition, then here by the use of this feeding, we will be able to provide the prescribed medication as well as the diet which one needs to consume, even though if he cannot eat or swallow. And as I have said that this can be done in order to provide the medication and the foods and also to obtain any substances from it. So here this is a tube. This is a tube which can also be used for suctioning the stomach content or the secretions. Now let us discuss about the Ryle's tube. This Ryle's tube, popularly known as the nasogastric tube or the NG tube, is a long and a narrow bore tube which is made up of silicone or polyurethane and is prominently used in order to gain access to the patient's stomach and its content. This nasogastric tube is mainly used for the treatment of stroke patient with dysphagia or even for the treatment of patient on ventilators. This nasogastric tube is inserted primarily for 2 purposes. The first one is for the nasogastric aspiration. This nasogastric aspiration is the process of emptying the upper gastrointestinal tract by aspirating the gastrointestinal secretion or the swallowed air. This nasogastric aspiration can also be used in cases of poisoning in order to drain the ingested toxic liquid or even to extract the gastric liquid samples for analysis. So here this nasogastric aspiration can be done in order to aspirate the swallowed air or the gastrointestinal secretion from the upper gastrointestinal tract. However, it can also be used in cases of poisoning whereby we will be able to drain out the ingested toxic liquid or even to extract the gastric liquid samples for analysis. And as I've repeatedly been saying that this can be done in order to feed and administer the food and medications. So now let us move on to the types of tubes. So here there are various types of tubes which are present. For example, there is a nasoenteric tube, which is a tube that can pass from the nostrils into the duodenum or the jejunum. And here, depending on the purpose, we can also choose the size of this tube. That is, if you require it for feeding, then you can use a medium-sized tube. Whereas if you require it for aspiration or for decompression, then you can use the long-sized tube. So just like this, there are various types of tubes that can be used for GI intubation. However, the 3 common ones are the Levin tube, the Morse tube, and the Salem-Sum tube. What is this Levin tube? This is a single lumen multi-purpose plastic tube which can be used in the nasogastric intubation. And this is mainly used for the administration of medications as well as the nutrition. And the second one is the Salem-Sum tube. So this is a double lumen tube with a pigtail, which is commonly used for intermittent or continuous suctioning. This Salem-Sum tube is a large bore tube with double lumen. Here, one lumen will be used for suctioning and drainage, whereas the other small lumen will be used for ventilation. So as I've said that this Salem-Sum tube is a double lumen tube. So here there will be presence of two lumen, where one is for suctioning and drainage and the other smaller one is for ventilation. Now moving on to the third one, which is the Morse tube. This Morse tube is a triple lumen tube with radio-opaque tip. So as we've seen that the Levin tube consists of only one lumen, the Salem-Sum tube consists of two lumen. Here this Morse tube consists of three lumen. Here the first lumen will be positioned and inflated in the cardia. The second lumen serves as an esophageal aspiration port. And the third lumen is used as duodenal feeding port. So here you must keep in mind that these are the three most commonly nasogastric tube, which is the Levin tube that consists of one lumen, the Salem-Sum tube which consists of two lumen, and the Morse tube which consists of three lumen. So what is the benefit of providing this tube? Here, when this tube is provided for those patients who cannot eat or who cannot swallow, then this can help them gain the adequate nutrition, can help them take the required medications even without putting any effort. Also, this is a less invasive alternative to surgery in an event where the intestinal obstruction can still be removed easily without performing any surgery. Since we have discussed about the nasogastric intubation, the purpose, the types of tubes as well as their benefits, now let us move on to the indication. Here, by inserting a nasogastric tube, you are gaining an entry or even a direct connection to the stomach and its content. Here, the therapeutic indication for nasogastric intubation includes the following. The first one is the gastric decompression. So here, this nasogastric tube is connected in order to facilitate decompression by removing the stomach content. So this gastric intubation is mainly indicated for bowel obstruction as well as for paralytic ileus. So here, when any surgery is performed in the stomach or the intestine, when there is paralytic ileus or even the bowel obstruction, then this gastric decompression can be done. The second is for the aspiration of gastric fluid content. This can also be done for drainage or lavage in cases of drug overdose or even in cases of poisoning. And the next is for feeding and administration of medication. So as I've repeatedly been saying that if the client is not able to eat or swallow, then by the use of this nasogastric intubation, we can still provide the food as well as the medications. And the next is to prevent the vomiting and aspiration. So here in trauma setting, by the use of this NG tube, it helps in the prevention of vomiting as well as aspiration. And not only that, by the use of this, we can also assess the gastrointestinal bleeding. So these are the various indications of nasogastric intubation. However, this is also contraindicated if the patient had undergone any recent nasal surgery or even if the patient has a severe mid-phase trauma, because these are the two cases. Since this nasogastric intubation requires the insertion of a tube from the nose, right? So if the client had any recent nasal surgery or if there is a severe mid-phase trauma, then insertion of this nasogastric intubation is contraindicated. It is also contraindicated in cases of coagulation abnormality, of esophageal variphysis, of alkaline ingestion, as well as of recent banding of esophageal varices. So if the patient is under these conditions, then this insertion of nasogastric intubation is contraindicated. So whenever you are inserting this NG tube, you cannot say that this is safe. There are certain risks and complications that can also occur, such as aspiration, discomfort, because here we will be inserting it through the nose. So some clients might be there who may not be comfortable with it. And because of this, it can also induce gagging or vomiting. So here, whenever you are inserting these tubes and when you find that a client is not comfortable with it, then a suction should always be present and ready in these cases. And the third one is trauma. So here, sometimes whenever you are inserting this tube, it can damage the tissues inside these sinuses, throat, esophagus, or even the stomach. Hence, it is very important that while you are inserting this tube, you must do it properly as well as carefully. Sometimes wrong placement of the tube can also occur, where instead of inserting it to the stomach, it can go to the lungs. So if food and medication pass through it, then it can also be fatal to the patient. It can also lead to other complications such as abdominal cramping, diarrhea, regurgitation of food or medication, tube blockage, and sometimes this tube can also come out of place, which can further lead to other complications. So here, whenever you are inserting this nasogastric tube, you must make sure that you do it properly, because here it can also lead to certain risks and complication. And the last one is the nursing consideration. So here, being a nurse, the following nursing consideration that you must watch for include providing oral and skin care. So here, since you will be providing this nasogastric tube to the patient, here is your responsibility that you give mouth rinse and apply lubricants to the patient lips and their nostril. You can also use a water-soluble lubricant where you can lubricate the tube until where it touches the nostrils, because sometimes the nose may be irritated or dry. The next is you must verify the NG tube placement. So here, how can you verify whether the tube which you have inserted is in the right place or not? Since I have said that this nasogastric tube must be inserted into the stomach. So in order to make sure that whether it is inserted to the stomach or not, what you can do is you can aspirate the stomach content, or even you can perform the x-ray. And the next one is wearing a glove. So here, as a nurse, you must always wear your gloves before you perform any procedure for the patient. Even here, before you start this procedure, you must make sure that you wear your gloves, because there might be a potential contact with the patient's blood or body fluid. So that is why you must always make sure you wear your gloves. And in some cases where the risk of vomiting is high, then you can also wear your face and eye protection. So being a nurse, these are the few things that you must watch for. So now here we have come to the end of this topic, whereby in today's session, we have discussed about nasogastric intubation, the purpose, the types, the benefits, the indication, the contraindication, the risk and complication, and also about the nursing consideration. So I hope you have got a clear understanding of this topic. I will be meeting you in another session whereby we will be continuing with this topic, and we will be discussing about the insertion of this NG tube. So until then, have a good day. Thank you.